Um, they are common to coexist. It's a different issue. Dr. Ami Kapadia believes that, and I think this question came up in the last several sessions, that the slow migrating motor complex in the small intestine, which is what can allow bacteria to back up and create SIBO, can do the same for yeast as well. And we know yeast is a normal, just like the SIBO bacteria are normal inhabitants, yeast is a normal inhabitant in the GI tract. It's, you're not going to eradicate it. You don't need to. It's more of an issue of when it overgrows, just like this. So I think that's really interesting take. She just presumes that that's what's going on. And there have been studies done on Dr. Rao's, Jacobs were famous for doing the studies on how much it coexists. And I don't remember now the exact amount. It was either 1/3 or 2/3. I've got it, because I can't remember exactly how much they coexist, but it's common. And not everybody has it. So I had years and years of practice where I did not have many patients who had yeast and SIBO at the same time. But I think what happens to so many of us practitioners, I know we've got Lena here who's a practitioner, is that universally it winds up that when you start, you tend to see a little bit easier cases. And then as you sort of get better and maybe you get more referrals because you're learning more, you wind up seeing people with multiple diagnoses and complicated cases. And so I think that's what was going on in my practice, but it just goes to show, I had years of really almost just like a handful of people that had both. And then it changed so that everybody I saw had both.